This Good to Go segment is sponsored by Corewell Health.
Sudden cardiac arrest is a leading cause of death in the U.S., killing more than 300,000 people each year. As the name implies, it happens very quickly and in most cases is deadly. If you are with someone who appears to be suffering from sudden cardiac arrest, it's important to know the basics of CPR and the use of a portable defibrillator if you have access. Now, here to tell us more is Corewell Health cardiologist, Dr. Andre Gori. He is a board-certified cardiologist and electrophysiologist and is a fellow at the Heart Rhythm Society. Hi, Dr. Gori. Good to see you.
Good to see you. Thank you for having me.
Absolutely. This is such an important topic, but explain to us, what is sudden cardiac arrest?
Okay, so sudden cardiac arrest is essentially when the heart goes into a very fast, chaotic rhythm and essentially stops pumping blood to the body. And if it's not treated appropriately and very rapidly, it oftentimes, most often leads to death.
What are the symptoms?
So the symptoms of sudden cardiac arrest are really, sometimes people have a known history of heart disease and they're known heart patients, but it can occur to people who have no known history, totally healthy, as we've recently seen on television with the football player Damar Hamlin. Elite athletes, children can also have sudden cardiac arrest. And there's oftentimes no warning signs of this.
So we're talking a sudden collapse is the first sign, right?
Correct.
And then upon checking, there are some other physical symptoms, right?
Right. So when somebody sees somebody unconscious on the ground, what I always tell people is assume it's sudden cardiac arrest until proven otherwise. Because the worst thing that can happen is that you watch somebody unconscious on the ground and don't act. And because every minute counts, and it can save a life if you act appropriately when you see somebody who's unconscious on the ground, who may be having sudden cardiac arrest.
Let's talk about the acting then. What is it that we're supposed to do? You don't want us to be a bystander. I know that.
Correct. Don't be a bystander. Be an active participant and save a life. And you don't have to be a doctor or a paramedic or a nurse to do this. And there's something called the chain of survival, which is really 3 simple steps. Recognize somebody's having a problem. They're unconscious, they're on the ground. Call CPR, call 911, activate the EMS system, and then start doing CPR. If somebody's on the ground and you start pushing on their chest and they say, hey, what are you doing? You're done. But if you continue to do CPR until healthcare professionals present with a defibrillator to restart the heart or jumpstart the heart, you probably just saved a life there.
Is there a certain person who is at particular risk for this?
Yeah, so great question. So, as I said, it could affect anybody. People who have known heart history, people who have had heart attacks or have something called congestive heart failure, they're at greater risk. But it once again, it can affect anybody. We've seen young athletes, we've seen kids who have no known heart problems succumb to cardiac arrest. And there's so many great survival stories where trainers or parents, people in the bystanders knew what to do. They knew how to do CPR. They recognized it. And those people, when it's recognized and treated promptly, can have totally normal lives.
I know some people are freaked out about the mouth-to-mouth part about CPR, but your whole point is those chest compressions, that's what matters most.
Yes, absolutely. So in the new guidelines of the of CPR, mouth-to-mouth resuscitation or breaths is really not mandatory. The most important thing is the chest compressions.
Got it.
So this is something that fortunately now is being taught in schools. I have 3 high school daughters who have now all been trained in their school, which I think is amazing. But you can just watch a video. It's essentially just pushing on the chest between 100, 120 beats a minute.
Well, it is certainly very important information. Thank you for that. And folks, if you need to find out more about this, you should talk to a cardiologist if you think that you may have risk factors or symptoms, etc. And you can contact Corewell Health Cardiovascular Services at 855-7-MY-HEART or visit spectrumhealth.org/heart. Dr. Gori, thank you so much.
Yeah, it's my pleasure. Thank you very much for having me. And I hope more and more people learn how to do CPR and more lives are saved in the community.
Yeah, for sure. Thanks.